What is reconstructive care? We have to expand the definition of subluxation beyond that of a minor misalignment of the spine. Chiropractic has 4 valuable final products. The first, that we're all familiar with, is relief of pain and symptoms. The second has to do with improving posture and increasing the curve in the neck and the low back. The third has to do with improving range of motion. And the fourth has to do with optimal performance, to be the best doctor you can be, the best husband you can be, the best tennis player you can be. The normal curve of the neck on a lateral x-ray is 35 to 45 degrees. This helps it better withstand stress and degeneration. Most whiplash patients after a car accident are at least phase 1 of degeneration. This increases stress to the bones of the neck. According to Wolff's law, bones remodel to stress. This increased stress causes extra bone growth on the cervical spine. This, in turn, can cause osteoarthritis or degenerative joint disease. And the lack of blood flow to the muscles can cause inflammation and trigger points. And the decreased curve in the neck may affect the cardiac and respiratory centers of the medulla oblongata. It can cause the cranial nerves to straighten on flexion and increases the stress to the hindbrain, the cervical cord, and to the nerve roots. And it may also affect thyroid function and vision as well. To have pain relief as a goal is a disservice to your patients. By eliminating pain without correcting posture, we're allowing for continued degeneration. To permanently alter reflex input, we have to do postural adjustments, cervical tractioning, extension exercises, and release trigger points. Adjustments without postural correction are just chiropractic aspirin therapy. The results are only temporary. Surveys have shown that poor posture conveys a feeling of depression, anxiety, unexpressed anger, impatience, and people don't trust you as well. Now we're going to show how to mark the stress vertebra on an x-ray. What we do is place a dot at the back of the body of C2 on the superior aspect and another dot at the inferior aspect. Connect the 2 dots and draw a straight line. Then we place a dot at the back of the body of C7 in the superior aspect and a dot in the inferior aspect. Again, we connect the dots, and where those 2 lines intersect is the stress vertebra. Now we're going to show the adjustment to improve the cervical curve. The next thing we'll be checking for is anterior weight bearing. That is when the head rests forward of the shoulders. The average head weighs about 10 pounds. So for every inch that the head is forward of the center of the shoulder, the head will weigh 10 pounds more. For example, if the head is 3 inches ahead of the shoulders, that'll be about 30 pounds extra weight that'll be carried in the neck all day long. So now we're going to check the width of the shoulder, which is 3 inches. Split in half is 1.5, and that brings us to right here on the patient's face, which measures about 1/2 inch in front of the center of the ear. Now we're going to demonstrate the anterior weight-bearing adjustment. It's useful to do a physical examination prior to tractioning. The first thing that we do is the foramina compression test. Turn your head to the right, please. If there's severe pain, it's best not to do tractioning. This is a cervical traction unit. This is the pillow, the cervical pillow. This is the weight, the chin strap, and the forehead strap. The purpose of cervical tractioning is to stretch the anterior longitudinal ligament and to allow a return of the normal cervical curve. The instructions we give the patient for home are 3 minutes the first day, add a minute each day up to a maximum of 20 minutes. And then we do 20 minutes a day until the normal curve is restored. We can also use ice during or after tractioning to reduce the discomfort to the ligament stretch. Next, we'll be going over the spinal rehabilitation exercises. The next exercise is done standing. We interlock the fingers. place the hands behind the head. The bottom of the hands are at the bottom of the skull, top of the neck. Lift the heels, arch the back, arch the neck, and lift the head off the top of the neck. This is a great stretch. This should not be done when the patient is in pain. Once they're out of pain, they can do this one. And this is excellent for returning the curve to the neck. The trigger point for both anterior weight bearing and hypolordosis of the cervical curve is just lateral to T5. The next set of exercises is to improve range of motion. What we're going to demonstrate is the Pedibond fulcrum exercise. The first aspect of it is to do flexion and extension warm-ups. So first we go into flexion, rounding the back, breathe in, arch the back, and go into extension. The next aspect of these exercises is the fulcrum exercise itself. For this, we start with the low back right on the stress vertebra in the lower back, and the neck piece right on the stress vertebra in the neck. So Candace, come over here. And we place this right on the stress vertebra on your back, and then right here on the neck. This one goes right at the top of the shoulders. Okay. Now, the first part of the exercise, breathe in, lift your pelvis, and bring your chin up towards your forehead. Now breathe out and come down. Now we need to measure the range of motion of the neck. Turn your head to the right. Good. Okay. Now turn your head to the left. Okay, that measures 70 degrees. Normal is 80 to 90 degrees. So now line your back, please. We're going to show neuromuscular re-education, or somatics, which was developed by Thomas Hanna. This helps re-educate the muscle which had muscle amnesia. Turn your head to the right, relax, sit up and we'll remeasure. Turn your head all the way to the left now. And now it measures a normal 80 degrees. I'd like to show you the pre-X-ray of a 33-year-old man with a reverse cervical curve of -10 degrees. At this time, he was suffering from severe migraine headaches. After just 3 short months, we've increased his cervical curve by a remarkable 22 degrees to 12 degrees. We accomplished this by giving him postural adjustments 3 times a week, and he did cervical tractioning and extension exercises every day for 3 months. Most of your patients can have their cervical curve restored. The definition of full structural correction is more than just relief of pain and symptoms. It has to do with full correction of the cervical curve and 100% range of motion. Thank you for caring enough to want the best for your patients.